All right, so if you are Black and on the kidney transplant list, then you're going to want to listen to this. You will get a letter by the end of this year, 2023, letting you know that you're going to get your kidney transplant within 1 to 2 years sooner than you would have. That's because they've officially removed the race variable test that's been done for years. This test always deemed Black people as healthier than any other race, and therefore it made us go lower on the list. Honestly, we would wait 64 months on the list, whereas white people would wait 37 months. Very unfair, right? Yes. Okay. Now, I first brought a similar story to you last year, so this is more definitive with more information. Now, if you're not Black, do not worry. It's not going to automatically move you down. Okay. The list fluctuates anyway, but it's just going to give everyone a fair opportunity. So reach out to your local kidney transplant center for more information, or if you have a case manager, reach out directly with them. If you have a loved one who's not on social media and doesn't know about this, please let them know as well. But always advocate for yourself, y'all. I'm so extremely happy about this. This is a long time coming. And again, you may be able to get your kidney sooner. This is amazing. This is wonderful
and
news.
A patient's eligibility for a kidney transplant.
The people that participated in this part of the study, there were about 1,500 white patients and fewer than 200 Black patients.
Dr. Martha Pavlakis is the chair of the nation's transplant system. She says of that small sample size, the Black patients had higher levels of creatinine, an indicator of kidney disease. So the test increased the creatinine threshold Black patients had to reach to qualify for a transplant.
They get run through that formula, and anybody who's listed as Black looks a little bit healthier and doesn't get on the transplant list until they're worse.
It's known as the race variable, and it's been used ever since.
Unfortunately, that approach has been rooted in our medical education, our protocols. The idea of using someone's skin color to put them in a box as if it has some genetic or physiologic meaning actually turns out to be potentially harmful.
The average wait time for Black patients on the transplant list in 2014 was 64 months, compared to 37 months for white patients. Even though Black people are 4 times more likely to be diagnosed with kidney failure than white people. But a policy change now in effect has banned that test and instructs every kidney transplant program in the U.S. to credit affected Black patients with time.
You can't use the race variable. That's a mandate. All transplant programs in the United States have 1 year to inform everyone on the list that we're doing recalculations.
Dr. Pavlakis said this change means Black patients could get a kidney transplant 1 to 2 years sooner than before.
For non-Black patients on the list, does that potentially move them down or in the opposite direction?
So the list is always fluctuating. My experience is that most people are in favor of a fairer system for everybody. If people have a sense that the system is racist, right, this will destroy faith in the system.
Those notifications are still going out through the end of the year, but you can call your transplant center and ask how this will impact you. We have more info on